and welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning and welcome to this Monday Morning Minute. I'm Dr. Todd Shatkin, and today we're going to be upgrading my patient Lindsay's dentures. She had snap-on dentures, and we're going to upgrade them to Roundhouse fixed restorations. Today we're going to be adding a bunch of implants. We're going to use her existing dentures that I've hollowed out, and we're going to just use those as temporaries. We're going to reline those with a little temporary material so she can wear these when she leaves. And then we're going to take upper and lower digital scans to fabricate permanent fixed roundhouse restorations for her. She had these done here about, I think, 3 or 4 years ago, Lindsay?
Yeah.
And now we're going to change her to permanent teeth. She got a few of her existing minis in there still. We're going to add some monos. I'm going to start with a 3.0 by 13, I believe, right? Is that what they are? 3.013s. So with a 3.013, we're going to make a 1.5 millimeter pilot hole. And I'm going to start at number 9 and 8 and see how the bone looks there. And a lot of times what I like to do is I will leave the pilot drill in there so that I know exactly where I want to place my implant. That way I don't have to look for the hole that I just made. So here's our 3.0 by 13 millimeter implant. I'm going to have Yuji here just unscrew that and take it out so I can see right where it is. And there we are. I like to start the implant by hand. You shouldn't be feeling anything, Lindsay. You doing okay? Uh-huh. All right, so I start it by hand and just get it to engage the bone. And then I take the driver off just to check the stability. I'm going to put it back on now. Not yet. So we put the ratchet wrench on, and we can do this with a motor or with the hand wrench, and I'll do a couple of each just to show you. But right now I'm just putting the first one in by hand. She got very, very good bone, very nice and dense. We have the nitrous oxide gas on her to keep her relaxed. So now we got that in there about 80% of the way. I'm going to bury it a little further because I don't want to have them hanging down so low where I have not enough room for porcelain. So I want to give the lab plenty of room to build our bridges and make them look real nice. And she's got ample bone up there, so I can bury this a little further. So we're going to put that in a little bit further. And that's about right. Okay, so we got our first implant in place. We're going to go ahead and do the tooth number 8 implant. We're going to put probably 7 additional implants in on top of the 3 minis that we have here. So we go ahead and make number 8. All right, I'm going to do a little bit more here. And again, I'm going to leave my pilot drill in there because sometimes when you make your pilot hole, the tissue closes up so quick it's hard to find where your implant's going to go. So I'm going to go ahead and place the next one. Go ahead and unscrew that if you can. Mm-hmm. Okay, but don't pull it all the way out. Yeah. Here, I'll get it. All right, just go ahead and take it out now. All right, we're going to get that started there. She got pretty dense bone, so we'll go ahead and place this implant. Okay, I'm going to go a little further. So I'm going to do a torque test here. You hear that beeping sound? That means we reached 30 Newton centimeters of torque. I'm going to go up now to 60 Newton centimeters. It's not spinning in there. So let's go ahead and go back to the ratchet wrench. I'm going to go ahead and use this driver. Hang on a second. Okay, we're beeping at 60 Newton centimeters of torque. So that's really good if you have very good bone. Oh, can you fix this? It's loose. It's coming off of here. So I'm going to go ahead and very good torque. And I'm going to do a tiny bit of a bend. This is a 3 millimeter. So we can do a little bit of a bend on that implant to straighten it. Okay, so we got our 2, 8, and 9 in place. Okay, now we're going to continue. We're going to go to number 7 and 6. All right, our next pilot hole. That's at approximately number 6, 7 area. This off of here. I don't want them to. I really like doing the monos mostly by hand. I use the motor only to test the torque. It's upside down. That's a little bit further than I need to go, so let's just see here. That bone in that one spot is not exactly as solid as I would like, so I'm going to remove this one. We're going to go to a different spot. I'm going to go a little more distal. We're going to go into the number 6 area here. Okay, let's try that spot. This should be better. You doing okay, Lindsay?
Uh-huh.
All right, good. Excellent. Okay. And we'll do, let's see here. We'll do one more. Open. We'll do one more of the 13. Okay, pull it out. Stay open, honey. So these are all 3.0 by 13 millimeter implants. When my assistant hands me the implant, he or she will tell me what size they're giving me, so I double check to make sure we're using the exact implant I want in the right spot. So always read that off, okay, Tali? That's very important, especially in the mandible when you've got a nerve to contend with. You want to make sure you're not using an implant that might be too long for the space, so that's really important. Okay, so we have 4 implants in already, Lindsay.
All right.
Now we're going to use an 8 millimeter for the posterior. I'll use the first 8 millimeter. Take it out over there, okay? All right, yep. Okay, let's see, right? This is, what's the diameter of this? 3.7?
8.42.
4.2? Okay, please read that out to me when you hand it to me. 4.2 by 8 millimeter implant here in the posterior because her sinuses are low. Stay open. So we're using the shorter implants in the posterior. Open big. You got to read the diameter and the length of the implant to me when you hand me the implant, okay? 4.2 by 8, and the reason we're using that is the width is very thick, but the sinuses are a little low in the back. Okay, very good. And we'll put one more of those 4.2 by 8s in the posterior. Now, typically with a 4.2, we'll make our pilot hole larger. So we're going to start with a 1.5, and then we're going to go up to a 2.0 after we make the first pilot.
4.2. 8.
And we went up to the 2.0 drill, right? So when you go over, so the 3.0 and the 3.3 implants, anything up to a 3.3, you could use a 1.5 drill. If you go to a 3.75 or a 4.2, I recommend going to a 2.0 drill. So this is a 4.2, so we went up to the 2.0 drill.
Open big. Good.
You're doing great, Lindsay. We're getting your last implant on this side in now, okay?
Mm-hmm.
Okay. So we got 5 solid implants on the right and 1, 2, 3, 4 on the left. So we're going to add, I'm going to add a 8 millimeter on the left side. And you can put shims on and scan this.
Yeah.
Okay. So we're going to go up to the 2.0 drill.
Open big. Good.
428. There's our 428 implant. And of course in the posterior we're using the non-bendable, otherwise known as a short collar, because the bendables have a long collar. In the anteriors we can use the bendables if we need to. Open, honey. She keeps closing. Stay open for me. Put that in a little further back there. Okay. I'm not thrilled with this one mini. It's got a little bit of movement. I'm going to remove that one. Where's a mini kit? Let's see. Open bag. You know how to open them now. This is the 10? Okay, open for me. So we're going right into the open. Okay, that's good. That's at number 13. All right, we're good.
You took that out and replaced it already?
Yeah, I put one out.
You're good, Dr. Todd. Sorry.
Thanks, honey.
I
Okay.
need to, I can't remember you.
You're okay. All right, we're going to
know.
start the bottom now. All the upper implants are done.
Huh.
So we're going to go ahead and put some 2015s in the lower anterior here. So we're going to go ahead and do the first pilot hole down here. Okay, first one. I'll get it if you have trouble opening. They're not easy sometimes. Okay, the Shatkin F.I.R.S.T mini implants, 2515. Is that where my hole was? I thought it was, maybe. Open big. No, that's not the spot. Hang on 1 second. Let me get that out. Where was it? Where was my pilot hole? Let's try a different spot. Huh?
It was more lingual, but
Well, that's why I sometimes leave the drill in, because I can find the spot easier. Yeah. Okay, we got 60 Newton centimeters of torque there. That's good. Where is she?
Shutting to the back, please.
Suction here. Another 15 to, don't move.
To 5:15.
No, let's see. Okay, we got those.
I don't know, but I think it's gonna be a 13.
Okay, in the posterior, we're going to use some shorter ones. Well, that was a 15, right?
Yep.
All right, now I'm going to use 13s. Well, I'll use another 15 before we get to that. Hang on. How many 15s do you have?
I have 2 more.
Okay. I'll take a 15. Thank you. So Shatkin F.I.R.S.T 2.5. This one's a 13. This is a 15 she's handing me here. 2.5/15. Okay, we'll take that out. If we can get it.
Can you miss that maybe?
It's okay, I'll grab it with this. Hold it. Take it off.
Relax your tongue.
Don't move. Sometimes I start at just the first couple threads at a higher speed just to engage the bone. Now we reach 30 Newton centimeters. Now we're going up to 60. Open bigger. Thank you. You're doing great. Okay, that one's all the way in. So now we're going to do one more 15. Where's my pilot drills? What happened to everything? Okay. All right, hang on, stay open.
13.25.
I said one more 15. You said you had one more 15 for me.
15.25.
She's got very dense bone. It's already beeping at 60 Newton centimeters. And I'm holding my finger on the buckle to make sure we don't come through the buckle plate. Okay.
Oh.
I'm sorry, honey.
Okay.
You're doing great. Okay. Good. All right. Now, we're going to do a 13/2.5. Obviously, you're not going to show this whole thing on the Monday Morning Minute,
Uh-huh.
but you can show excerpts of it, right?
1325.
And we can use this as a lecture.
Sure, absolutely.
We're getting good torque. Okay, 13s. Couple more 13s and we'll be good. Next one.
1325.
Is my light on?
No.
Huh?
No.
Can
There
somebody
you go.
give me a new light?
It's on now.
I think it died.
The voices?
It'll go off again.
Okay.
Okay, again it beeped at 60. Okay. And another 13.
It's okay.
Keegan, we're filming this recording, so I'm doing all the implants here, but I'll have you come over here and do the one on this side. And again, we reached 60 Newton centimeters back here of torque. She's got very good bone. All right, that's good. Okay, so 2 more implants on the right and we'll be all done, my dear.
All right.
Here, Keegan, come on over here. This is Dr. Keegan. He's one of the Shatkin Dental Health NYU Langone residents that just started here for our program. All right, I'm gonna put that, okay. Hey, stay open, honey, don't move. Come here, come on over here. I have you place this implant.
1325.
13 by 2.5.
Okay.
All right, so go right in there. Take that pilot drill out and you let him remove it so he sees where to put it. Should be loose enough to just unscrew. You got it? Yeah? You see the hole? Okay, and just keep the angle the same as the other ones, okay? All right, and just push the pedal. Get a little lingual, just keep it more vertical here a little bit, okay? Keep going. It's beeping at 30 Newton centimeters. Okay, let's see. Let's go to number 3. Go a little further. Okay, stop. That's pretty good. Take it off. Open. Open up. Take it off the implant. Okay, good. You got it.
All right.
All right?
Thank you, doctor.
Yeah, and let's see here. So, Keegan, if you look closer, you'll see the collar.
Yes.
The square and ball are above the tissue, but the collar is still a tiny bit above tissue, so I'm just going to turn it down so that the collar is flush. The polished collar, top of the polished collar is flush with the tissue, okay?
Okay.
Couple more turns and we'll be right there. Okay, there you go. See? See how it's almost just about right flush with it? Can you see that?
Yes.
Okay, so you want the square and ball above tissue, but you want the collar to be flush with the tissue, okay? So let's see, we got one more to go. Let's do one more in the back. Why is this okay?
Maybe that's how it would be.
Yeah. Okay, that's not very dense bone in the back there.
Doing great, Lindsay. Almost done with the implant.
Okay. All the implants are in. Okay, good. So we can go ahead and scan this, all right? So we've just successfully placed a bunch of mono implants, a bunch of mini implants, upper and lower, to upgrade my patient Lindsay here to fixed roundhouse restorations. Now my staff is going to take over and do the impression scanning with a 3-shape digital impression scanner. And I'll come back in and take the bite afterwards, and I'll show you how I take a special bite with edentulous patients. So I'll be back in just a little bit. Okay, so now we're getting ready to take our bite registration, and I like to call this the Shatkin patented 2-cotton roll technique. It's not really patented, but my concept is just basically to open the vertical enough to get a good bite and estimate how much vertical. And it seems that 2 cotton rolls is the trick in most cases when I have implants in place. So what I do is I put the 2 cotton rolls in, just like this. I have the patient bite gently together. Gently, gently. Just about there. Can you hold it right there without moving? Gently bite, you're opening. Close a little bit. Okay, right there. Hold it right there. And then you just hold it right there, and we're going to go ahead and scan this. Pretty good. That looks good. And if we need to, if the lab needs to open the vertical just a little, they can. But I think we got it pretty good here. So let's go ahead and do the registration. So I'm using a product called Futar from Kettenbach. And this is just a bite registration material, and it'll hold the denture in place while we're waiting for the permanent teeth to be done. And Kettenbach is one of Shatkin F.I.R.S.T's favorite product lines. They sponsor Shatkin F.I.R.S.T, and I use all of their impression material, their bite registration materials, their core buildup materials. It's a really great company to work with. So Kettenbach is my friend, and so we're using bite together for me. So a little, not all the way down. Open. Let's see what's going on here. I think it's being held up a little bit in the back. Okay, just hold the upper, and I'm going to go hollow this out a little bit more. Okay, let's see. I want to see if this will go in now.
I'm going to put the new one.
Close together now. That's better. Okay. All right.
Is this the same gun?
Open. All right, let's go ahead and do this. Try it.
Try it.
The more you can keep these teeth in for the next 2 weeks, the better, okay? And then we're going to get your permanent ones made. I'm basically doing like a rubber reline inside here, okay? And bite together, nice and tight. Okay, we got the bite where it needs to be at least. Yeah, I'll put a little tiny bit more down here. Okay. Are you staying overnight tonight? So I'll check. Oh, till Friday. So I'll check you tomorrow, okay?
Friday.
I'm sorry?
Tomorrow
or Friday, either way.
We can see on Friday.
Either way, before she leaves town, okay? And get a CT scan before she leaves here. Okay, open. Let me take this out for a second. So that's what she's going to use for the temporary. Have the scissors, please?
I can grab you some scissors.
There's a kit right there.
Oh, yeah.
How are the other residents doing, Keegan?
Good. I think we have a meeting on an afternoon.
Oh, you have a regional day or
Yeah.
again?
Or, yeah, there's different.
All right, so just keep these until I see you for sure, okay, my dear? Let me go ahead and snap those in.
We didn't trim the top.
Open. Okay, open. Okay, that's good. Bite together. Up, open. Up, it's not in. Let's get the back in here. Bite. I think it's okay. All right, very good. Lindsay, you did fantastic. So we've successfully placed a bunch of mono implants in the upper jaw and a bunch of mini implants in the lower jaw. We have 10 implants on top and 10 on the bottom total. And Lindsay did great. You were a great patient. And I know you told me that you watch my Monday Morning Minute from time to time.
I do.
And so now you're going to be a star.
I'm excited about it.
All right? You're going to be on the Monday Morning
I'm going
Minute.
to watch myself.
And we're going to see you back here in a couple of days to check you, and then we're going to see you in about 3 weeks to put your new teeth in. So we'll have a sequel to this Monday Morning Minute, and we'll get you on there a second time.
All right.
Okay?
Okay.
All right, but you've done pretty well with your snap-on dentures all these years. Now we're going to give you something more permanent, nothing on the palate, no plastic. It'll be really pretty.
Be awesome.
All right, honey? It's
Thank
great
you.
to see you.
Happy to see
and
you.
we'll
Thank
see
you.
you soon. Thank you for joining us on the Monday Morning Minute. We'll see you next time.